also to build community-based psychosocial services. I've seen it, good work. But over the years, funding reduced in that emergency, and when the new emergency came, not that much funding was allocated. So the dependency of international NGOs and international organizations is an issue. Fortunately, we see that there are progressively national NGOs taking over. It takes time to build capacity, but we clearly see in the east of Chad that national NGOs are getting stronger, which is really a sign of hope. Things do happen. In 2024, our health information system for the refugee facilities that UNHCR supports recorded 30,000 consultations for mental, neurological, and substance use conditions. That is a lot, but it's by far not enough.
Yeah, you told me.
Then in one province, in Wadai, 85,000 people participated in psychosocial activities in communities led by NGOs. That's great. By far not enough.
Okay.
In 2025, some additional initiatives, and they're just too good not to mention them. The Chadian Association of Psychologists, with support from WHO, IOM, UNICEF, UNHCR, UNFPA, sent psychologists to one of the most affected provinces. And it's great. The effects of what these psychologists did was good. They could do psychological first aid. They referred people with severe mental health issues to health centers. And in general, they created social connections in communities that were fragmented by displacement and war. Another initiative by Zaina Awad, a deployee from the Dutch MHPSS support mechanism. She was hosted by UNHCR, and she trained national staff, Chadians, and also Sudanese community mobilizers in psychological first aid. And not just in psychological first aid, but in how to train others. Brilliant initiative and really heartening. Other examples is that mental health and psychosocial support is really integrated into programs for gender-based violence, for education and others. So there are really signs of hope. But, next slide. Ultimately, the humanitarian response is not sustainable. We have some money now, but we need to find ways to make our work more sustainable. And that is a big challenge. Next slide. Now, one way to do that is the Green Tree Acceleration Plan that was already mentioned by Fiona in her introduction, which is funded by the Wellcome Trust, a major medical research charity. And they are moving more into public health now, global public health. So the plan in Chad, you see lots of partners are involved. On top, of course, the government of Chad, the UN agencies, including mine, but also UNFPA, NGOs like Action contre la faim, World Vision, but also on the bottom, national NGOs. Very important. It's one big consortium. And the idea is that all these actors together will do a few things, but do them well and scale them up massively. And the three things are, one, strengthening the national mental health system. There is some work needed on mental health policy, making sure there are some specialists in the country, but also training non-specialists through what we call MHGAP documents of materials by WHO. You can train general doctors and nurses in providing basic mental health care. That needs, it is happening, but it needs to be done more consistently and be scaled up. Secondly, we need to go beyond the model, and we need to make sure that people who need psychological interventions, counseling, can get it. We chose one intervention, problem management plus, 5-session counseling, well documented. We want to scale it up in communities, a kind of pilot where we can see, does it make a difference if you add livelihoods components, particularly for vulnerable women who may have experienced gender-based violence. 3, not forget the children. For children, it's always difficult because the age talking intervention. So we chose an intervention that works through movement. It's called Team Up. Also well-researched, provide that in communities massively as well. So really the idea here is to choose evidence-based interventions and scale them up as good as we can by linking them also into community systems as well as into national systems, because in the end, these community systems and these national governmental systems have to take the work forward. Next one. This is my last slide. Basically, this for humanitarian work and integrating it into sustainable responses. First is to integrate mental health and psychosocial support in all the work that we do, not just a narrow, small sector of only some psychologists and psychiatrists. It needs to be integrated, and there are good examples. The minimum service package that Dr. Fahmy mentioned is a brilliant example on how you can help actors to do this. Secondly, we need to double down on localization, working with local and also refugee-led organizations. I've seen brilliant Sudanese refugees, highly qualified, highly motivated, but not always given the opportunity to help their communities. So that's the second one. And third, of course, is linking with development actors, including multilateral development banks who are interested, like the World Bank. They do see the need to integrate mental health to keep countries stable. But we need to work hard to realize that. And what we do need is high-level advocacy, which is why the Green Tree Acceleration Plan is so important. It's Amina Mohammed, the Deputy Secretary General, who puts her weight behind it. And it's Julia Gilliard, the ex-Prime Minister of Australia, who is now the chair of the Wellcome Trust, who really says we have to do this by joining forces. Thank you.
Thank you very much, Peter. Indeed, integration for profound outcomes is the way to go. I'll continue to invite our next speaker, Rita Taye, who is the Mental Health and Psychosocial Support Global Lead Surge. Kindly put on your speaker on, Rita.
Yes, hello.
The floor is yours.
Thank you so much, and warm greetings to. I'll be sharing a glimpse of my experience as a member of the RVO Surge mechanism that is supported by the Netherlands Enterprise Agency. And this mechanism plays an important role in humanitarian response by rapidly deploying experts to countries in times of crisis, basically to strengthen coordination and build local capacity and ensure that mental health doesn't fall through the cracks of emergency response. But it's not just about being fast, it's also about being connected, because each surge member is part of a global network of peers, mentors, and technical experts who stands ready to support. What also makes this mechanism very powerful is its interagency and cross-sectoral nature. And more recently, it has expanded its focus within the humanitarian development peace nexus, working more intention and peace building closer together to be able to support communities not only to cope, but also to rebuild relationships, foster dialogue, and restore the social fabric. Next slide, please. So let's zoom into my most recent deployment that was in Lebanon, a country that has endured multiple over impact of war. And when a crisis hits, what happens to mental health? Often people's well-being is the first thing to be shaken and one of the hardest to rebuild. And what does it mean to work on mental health during times of emergency? It means facing stigma that keeps people silent. It means working in an economic collapse that makes it even harder to find the resources to support people's needs. And it means trying to support frontline workers who are themselves exhausted, displaced, or grieving. So during my deployment with WHO, I had the privilege of working alongside the National Mental Health Program, and the partners constantly had this question in mind. How can we build a system that responds to today's crisis and is strong enough to face tomorrow's? So what did we do? Next slide, please. One concrete example was organizing a series of multi-sectoral workshops using the minimum service package. These workshops brought together over 100 decision makers from UN agencies, NGOs, and ministries. And something powerful happened in those rooms. People who haven't connected before began to collaborate, to plan together, and to align their vision on what a stronger MHPSS system could look like. Another example is the establishment of a core coordination group that is an inclusive platform bringing together different ministries, UN agencies, academic institutions, NGOs, and service user associations. It is a space not only for coordination, but also collective problem solving and shared ownership. And finally, we worked on adapting a national emergency response plan that integrate preparedness, response, and recovery while keeping sustainability at the center of each step. And now, looking back, a few reflections stay with me. First, people, before it's about structure. It is built on relationship, trust, and shared purpose. Second, that evidence-based approaches help us build systems that are not only reactive, but adaptive, and ready to change as needs evolve. And third, that sustainability must begin on day one, because what we build during an emergency must be strong enough to stand long after the crisis fades. And in closing, I really want to honor the dedication and humanity of all those working to make mental health a priority in emergencies. In Lebanon, I witnessed first responders and local actors, many of whom were displaced and affected themselves, continuing tirelessly to support others with empathy and courage. And that, to me, is the spirit of the RVO search mechanism. It's not just about rapid deployment, it's about rapid solidarity. It's about showing up, standing together, and believing in communities and their capacity to heal, rebuild, and lead their own recovery. Thank you.
Thank you very much, Rita. Indeed, solidarity, togetherness is the way to go. We give you a salute and all colleagues who stand in front during emergency response. I'd like to, for the day, Anne Filoriza Pla, the Mental Health and Psychosocial Support Global Lead at Save the Children. Over to you, Anne.
Every day, every hour, children and adolescents are affected by emergency around the world. And too many, the ones who survive, many live with serious distress and psychological challenges. Evidence shows that exposure to natural disaster, violence, separation, and nutrition exploitation deeply harms in the short, medium, and long term. On this day, we celebrate mental health. But maybe we should ask ourselves the right question. Why there are still many children and adolescents denied their right to mental health when the crisis happened? Didn't we agree that children and adolescent mental health should be at front and central? Do I have to go again explaining life-saving? And I hope that I don't have to convince you again. So here is my question, why? Why this right is still... They keep asking this question, how can we do that better? How can we ensure that every child, every caregiver in emergency know who to call, where to go, what to do which is not going to harm them, how to cope positively? And one of the first things that came to our mind and that has been repeated by our colleagues might be, maybe we must begin by ensuring that humanitarian workers, volunteers are safe, supported, and trained to identify and assist children in distress. If you want to have access, you need also to know, to outreach, to know where are these children, how can we show them where to go safely, but also for them without harming themselves. I really would like to take the opportunity to thank all of you colleagues, humanitarian worker, volunteer, colleagues at country office, and even in headquarters. Thank you for your dedication. Thank you for your tireless work. Afghanistan, in Gaza, in Syria, in Sudan, in South Sudan, in Nigeria, and the list is far too long for the time that have been given to me. But thank you for continuing to devote your life protecting children and families. Colleagues, we see you, and we are immensely grateful for your work. So we must ensure that this safe, this trusted adult exists, but we need also to ensure that this trusted person understands child development. How do you communicate with empathy? And we have an example of how to train with the child and adolescent mental health diploma that we designed for this, to promote this. Because we do know that early intervention, especially before the age of 14, when half of the mental health conditions begin, can reduce the lifetime risk of depression by up to 50%. And obviously, voice, their participation needs to be meaningful, please, not symbolic, not just like something you tick on your checklist. Children and adolescents know what support there will be. And if they don't, it's still our duty to act. We still need to ensure their dignity and do it with care. Finally, we need to continue to advocate to government to develop a strong child and adolescent mental health policy. We need to link education, health, child protection. Only a true multi-sectoral collaboration can ensure that children in distress are protected and supported to realize their rights. On MHPSS, on mental health and psychosocial programming have been devastating. The consequences have deepened the suffering into families, undermining recovery within communities. So more than ever, we need to remind what mental health is and fight discrimination. And we need you to join our advocacy and to support you and find inspiration. Our colleagues will put a link for you to access our multi-agency resources advocacy paper on humanitarian action. Together, please, let's make mental health a right for every child, everywhere and at all times. Thank you very much.
Indeed, that is so profound. If we know we can reduce depression by 50%, so what is the reason that we don't want to actually act on it now? Why should we wait to treat when we have the power to actually provide early interventions? Thank you very much for sharing that insightful inspiration. We want to appreciate you for listening and and we want to let you know that we appreciate your time. And as we move on, I will invite Tuyoshi Akioma to respond to the question, why must mental health in emergency be prioritized as a core component of humanitarian response? I know this sounds familiar and very profoundly drummed for many years, the prioritization for mental health, but we want you to briefly just let us know why should it be a core component, not a by the way.
Access to mental health is always a problem. It is never easy. However, under emergencies, catastrophes, of course, the situation gets exacerbated. As I said, sometimes people may be dehumanized. Then it enhances the need or lack of the service access by 10 times, 20 times, 50 times. Mental health access is always important, but under these conditions, situations, we feel the need very painfully. That's the reason why we chose this theme. Thank you.
Thank you very much. Indeed. I'll turn to Raija, your wealth of experience, particularly, working in humanitarian response. It is really not just a priority, but it has to be a core component, to be integrate mental health in the response, just equal like any other humanitarian needs. Why is mental health important? Raija.
Yes, thank you, Fiona. It's very important. First, because mental health, it upholds dignity and human. Second, what also mentioned, Fahmi was mentioning, it has been in the world, in WHE Assembly, it's a resolution now that we have to put it in our preparedness, response, in everything to be integrated. Disruption of people's life and the destruction, the level of stress will increase. Therefore, it's very important for us to be able to work on the mental health of the people. It will also facilitate the recovery and the resilience and being able to have more hope. So this is something that we need to work on. And of course, not to forget, people with mental disorders, they will have a problem to reach the basic needs. So it's important whenever we have any emergency that we need to respond and to provide support to people with mental disorders. And second, I was saying that neglecting mental health delays recovery and of course ensuring caring for the carers who are providing the support in emergency. I mean, like in Gaza, in the last 2 years, they have not stopped. We need to support them. Therefore, mental health is very important to be integrated in the emergency response from the beginning, from preparation, planning, responding, and implementing. Thank you, Fiona.
Thank you. Very profound indeed for better out. Integrate mental health in preparation, before, during, and after. I would like to turn to Pinta Ventavo from UNHCR. You've really been key to actually develop guidelines, policy frameworks like the interagency guidelines, the minimum service pack, the WHO Comprehensive Mental Health Action Plan. How do we move all these global guidelines in that the field offices can actualize into measurable, equitable outcomes of people affected by crisis? What do we need to do to make sure that these policies are relevant and these guidelines are relevant for measurable outcomes?
That is the $1,000 question, of course. First of all, I must say we have made great progress. When I started this work some 20 years ago, there were actually no guidelines. People just did what they thought was the best. We now have really solid guidance that is made by multiple agencies, like this IASC guidelines from 2007. That's really the birth of humanitarian mental health and social support, but also super important, this minimum service package. And then WHO, extremely important with the member states, this mental health action plan. So the guidelines are there, but how can we make sure they're used? Few things. First, people need to know that requires capacity building. So to give an example on that minimum service package, together with UNICEF and WHO and UNFPA, UNHCR has done many capacity building workshops, and it makes a difference. We've seen it in Ethiopia. Many workshops, we see it makes a difference. People get it, people start to collaborate and around exactly the same topics and the same interventions. It helps. But that's not enough. We also need to make sure that it is known by, let's say, the decision makers. And how to do that is, one thing is to make sure mental health is well represented in, let's say, policy documents. So for humanitarian emergencies, you have these humanitarian response plans, very high level often, but super important if you have MHPSS basis of the next phases of action. Similarly for refugee response plans in refugee settings. So that's really important. And that needs to be paired and linked policies. So for example, the example I gave in Chad, it is important that the government then starts to use these tools and ingrain them into national policies and guidelines. Second point, make sure that it's in high-level documents. And the last one is basically to connect these two, is you need champions. And I would say there are many champions, but one group are people from the ground, people with lived experience, people who can really talk about how mental health interventions have helped them. Secondly, that's bottom up. Top down, you also need people. You need high-level people like Amina Mohammed, the other high-level people, Tom Fletcher, the head of OCHA, the big coordination agency for humanitarian aid. He has been to Gaza and he talks about it. You can find the video. He talks how it has affected him to see all the violence and the suffering. He understands it. We need policymakers who understand it. Thank you.
Thank you very much. All of us are needed to be able to ask a final question. You've mentioned a lot around children and frontline workers very deeply. And I would like to ask you, how can we ensure that children and families and frontline workers are not just recipients, active participants in designing, sustaining mental health responses during emergency response? So over to you, Anne.
In 2 minutes, which would be like an answer of minimum half an hour. I think the first point is we need to remove this assumption that children don't understand or they can't express their need, or what they do is crying or doing a drawing. I mean, children have a lot to say and they have a way to express it, and it's a work. It's a consultation work that we need to put in place in a mandatory way to very much understanding how they can be better supported within crises. At the same time, I suppose if we created more participatory programming, I mean, we have I Spot My Friends, which is an interagency with Save the Children, UNICEF, WHO, the collaborative. We created this PFA for children where they learn empathy, peer support, coping mechanism, instead of using stigma and bullying. This program build the child confidence and skills to advise, to help, to shape the response that affect them. So if you involve from the beginning in preparedness, in anticipatory action, youth, adolescent, and younger children, whenever you have the resources to do so, well, you have a response which is much more relevant, which is owned by the community, which is owned by the children. Frontline workers, as I need support, they need mental health support. They need to know that they are understood and that the fact that they have to accompany persons who are facing very stressful or traumatic situation, that they also have a backup, that they also have someone who supervise, who accompany. In their supervision, we can be extremely creative, but what we need is capacity sharing, strengthening, building on together with colleagues who have experience, understanding of the culture and understanding of the context, and help us to adapt the different tools to have an answer which is, again, owned by the community, owned by themselves, and hopefully which created a much more sustainable well-being for the world community. Over to you.
Thank you, Anne. And I would like to invite Fahmi to give us key takeaways for today's World Mental Health Day. Over to you, Fahmi.
Inspiring inputs from all the panelists and the great question we got. We have drawn together the mental health and psychosocial support bridge, the bridge from suffering to coping. We need to lower it, fund it, staff it, coordinate it, and hand it. Fund it, donors, please fund it. Staff it, policymakers, please staff it. Coordinate it, mental health and psychosocial support experts across sectors. Together and hand it to local champions and local communities. A good colleague was asking about localizations. Indeed, all the work we do and discuss need to be totally built with and owned by local communities, as what we have in IC guidance. Investing in mental health and psychosocial support, as many speakers emphasized today, and many of you in questions, is the only bridge for recovery. When the next siren sound is heard, and actually while we speak now, I saw on somewhere in some emergencies such as Ukraine is ongoing. When next siren sounds, access to mental health and psychosocial support in all next emergencies and ongoing should not be only an aspiration. It needs to be our standard practice across sectors and across all emergency phases. Mental health and preparedness response and recovery, covering universally everyone, everywhere where they need it, is a right, not a luxury or add-on. Humans don't live only with water, food, medicine, and shelter. They need much more to be able to cope and thrive. I thank our Mental Health Innovation Network colleagues for hosting us today. Thank you, Joy. I thank our World Vision colleagues for moderating, partners who selected the topic for this day, the World Federation for Mental Health. Thank you so much. Save the Children for highlighting the needs of children in emergencies. Our colleague in WHO Palestine for the incredible work you're doing in the front lines that the world clearly needs. The great work done by the Dutch Surge Support, RVO, and Rita, particularly in Lebanon during some of the most difficult time, is a great example. Rita is from Lebanon and was deployed in Lebanon during some of the most difficult times and days. I thank my colleagues in WHO Geneva for their work and for their support in this webinar, particularly my colleague Maya Bashit. I thank you all. And when we get asked, is there hope in this world? I think the very fact that we had more than 1,000 people staying for 1 hour, coming from all continents of the world, responding to emergencies from multiple organizations, UN, NGOs, and civil society, is a source of hope. Keep up going all the good work and your commitment to mental health. I hope this day is a renewed commitment for us for the value of mental health, including in our own life. Thank you and happy World Mental Health Day.
Thank you indeed, everyone, for joining, and particularly for World Health Organization, the World Federation of Mental Health, and the Mental Health Innovation Network for organizing this event. I also wish to thank your valuable inputs in today, and also our two colleagues behind the screen, Joy Muya and Maya Bachat, for all the coordination behind the screen. And to you all for staying on call for 1 hour, we want to appreciate you, and we want to let you know that all the recordings will be sent to you after the presentations. And we also want to appreciate those who have put their life at the forefront to humanitarian emergency. We want to thank you and appreciate you, and remind you to still check the resources and the key messaging on World Mental Health Day, which is mental health in emergency matter. Investing in mental health is investing in recovery. Protect your mental health. Mental health is essential. Mental health care saves lives. Promoting mental well-being through multiple approaches. Integrating mental health strengthen emergency response. Inclusive mental health care builds stronger communities and protect the well-being of humanitarian workers. Thank you, everyone, for joining in your work, and we want to wish you a good mental well-being as